Hi, I'm Tammy Fletcher and welcome back to Talk Therapy channel on YouTube. Today is the last day of Body-Focused Repetitive Behavior Awareness Week, and I'm getting this video in right under the wire. This year I've seen huge strides in raising BFRB awareness. I'll put some links in the description bar below to show you some of the things that have been going on in social media for the last couple of weeks. A big part of my job as a therapist is psychoeducation, and because there are still so many misconceptions out there about BFRBs, my video is going to be about clearing up some of those misconceptions and answering some frequently asked questions. So this subject matter will be a little bit broader than some of the other videos I've made in the past. Okay, I'm working off questions that were sent to me. So let's start with, what is a BFRB? Body-focused repetitive behaviors can include a variety of different behaviors. They can be chronic hair pulling, skin picking, nail biting, thumb sucking, picking at your cuticles, anything that is repetitive and chronic. Perhaps the person has tried to stop and not been able to. Sometimes they're aware of it and sometimes they're not. All of these types of behaviors fall under the umbrella term of body-focused repetitive behaviors, or BFRBs. Okay, the next question is a BFRB the same as self-injury? This is a common misconception, and I hope my answer doesn't make it more confusing. BFRB behaviors are damaging to the person's skin or scalp or hair or nails or appearance. So there is a degree of self-injury there, but it is definitely not the same as cutting or another behavior that's a very deliberate infliction of pain. BFRBs are probably more appropriately categorized as impulse control disorders, and even then not everybody fits that criteria. Next, aren't BFRBs just a bad habit? Body-focused repetitive behaviors are habitual in nature, but they are far more complicated than just a bad habit. And that can contribute to what makes it so frustrating for someone who is trying to recover from a body-focused repetitive behavior when they are asked or told by a loved one or a friend or even a doctor or therapist, why can't you just stop? It's not that simple. Oftentimes professional intervention is needed to help the person recover from the behavior, and so it is definitely much more complicated than just a bad habit. Next question is, who gets BFRBs? Anyone can develop a body-focused repetitive behavior. It's estimated that 1 in 20 people has one. Some people will remember a parent or a grandparent or somebody in the family who also exhibited the same behavior, so it can run in families. It's impossible to pinpoint which person is going to develop a BFRB. Some people may have impulse control disorders, others may have a possessive compulsive disorder, some have anxiety, and some people don't have any diagnosis at all, but they still have a BFRB. So the next question is, how are BFRBs treated? The best results for treatment occur when the therapist or the doctor has specialized training in BFRBs or personal knowledge, or both. Now that said, what we find to be the most effective treatment at this time is behavioral therapy. This can include techniques from cognitive behavioral therapy, habit reversal therapy, or HRT. In those cases, we teach the client a set of alternative behaviors to help them get their focus back and to choose a different behavior. We also use something called stimulus control, which helps the client to identify triggers in their environment, in their daily routines, and to begin to restructure as much as they can to assist them in eliminating the behavior and choosing a healthier, more preferred behavior instead. So let's use trichotillomania as an example. When someone comes to see me, I will ask them an extensive amount of questions to get a comprehensive picture of their pulling behavior. I want to know where, when, how, and why they pull their hair. And that enables me to design a very specific treatment plan that fits that person's specific needs. Now, as a psychotherapist, that's how I work with my patients. Sometimes people will also, or instead of talk therapy, will seek assistance from a medical doctor, and they may try psychotropic medications. There's mixed reviews on how things like Prozac and medications like that work with BFRBs. For some people, I know that they do. For others, they do not. So the decision to take medication is definitely one to take very seriously and to talk over with your doctor. And one of the best things that can happen from using medication, if it's effective, is that it can help make the talk therapy portion even more effective. Okay, next question. I have a BFRB and I'm not improving. Why? That's a good question and a very common one. BFRBs are complicated to treat and complicated to recover from. Most people who come to see me, and I think this is probably true for most therapists, have been pulling or picking, engaging in this behavior for a very long time, sometimes decades. And also there's no one treatment that works for everybody, just as there's no one reason that people engage in a body-focused repetitive behavior. So if you feel like you're not progressing in treatment, I would probably ask you some questions. I'd want to know if your therapist understands BFRBs and they're treating you from that perspective. I'd want to know if you're given homework, and I'd want to know how well you are adhering to your own treatment plan. It takes time, vigilance, creativity, and determination to recover from a BFRB, but it is possible. So I guess I would put the question to you, what does improvement look like for you? For me, improvement or progress is not a black or white thing. It's not you're either picking or you're not picking. It doesn't work like that. Progress to me is you had an urge and you were able to put it off for 5 minutes. That's progress. Progress means you are adhering to your treatment plan and making changes in your environment to enable you to resist the urges to pull and to avoid triggers. Progress can sometimes be measured in baby steps. So I guess what I'm saying is make sure you're charting your behavior, you're keeping a journal of picking or pulling or whatever the behavior is, and then really monitor how you're doing and stick to your treatment plan. Okay, the last question is, my loved one has a BFRB, how can I help? People with BFRBs sometimes have a lot of embarrassment and even shame about the behavior. So I guess the first thing would be to be sensitive to that, just be aware of it. They may go to great lengths to cover up any evidence of the BFRB. So just kind of be aware of the person, follow their lead in terms of what they need from you. You can just ask them. Sometimes that's a good way to get a conversation going, and it lets the person know that you're open to them coming to you to talk about what they need for support. You can offer to be there to talk about it. You can ask if they want you to remind them if you see them engaging in the behavior. Most people don't, but it's respectful and helpful to ask. Basically, learn all you can about BFRBs so that you can be of support in whatever way the person needs. And definitely, as I mentioned earlier, don't be the person that says, why can't you just stop? If they could just stop, they would, I guarantee. Thank you so much for watching. I hope this cleared up some misconceptions. If you have any further questions, please put them in the comment section below. If you are a person with a BFRB and you would like to comment on typical questions that you get or misconceptions that you notice, please do that as well. I'll see you next time.